This Week in Richmond is made possible in part by Dignity Memorial, caring for our communities with a network of funeral homes and cemeteries in Virginia and throughout North America. More information about Dignity Memorial's providers is online at dignitymemorial.com. Alpha Natural Resources, an energy company dedicated to respecting the land. Alpha Natural Resources, we power the world through the energy of our people. Haley Buick GMC, the place for a new Verano or Terrain Denali, in Richmond and online at haleybuickgmc.com. Everywhere there are lighting poles, there's one more opportunity to save money. Intelligent Illuminations provides cost-effective wireless lighting solutions for roadway or area outdoor lights. Kanawha Valley Arena, Virginia's cowboy town, hosting an array of events from Civil War reenactments to diesel truck pulls. More information online at virginiarodeo.com. The Virginia Chamber of Commerce, the voice of the Virginia business community, working in legislative, regulatory, and political arenas to promote the free enterprise system. So what do you do? Information about getting involved in advanced technology careers, making everything from clean energy to life-saving medicine, is available at dreamitdoitvirginia.com. Additional support is provided by these sponsors. And by the members of Virginia's public television stations. Thank you.
Welcome to This Week in Richmond, and a very special welcome to two senators, Senator Dick Black, Senator Bill Stanley. You came into the Senate about the same time. You came in a year earlier in 2011, 2012 for Senator Black, but you had a stint in the other chamber from 1998 up to 2006.
That's right.
We welcome both of you.
Thank you.
We'll tell our viewers that we've been talking about snakes, but now we're going to start talking about legislation. But
that's a distinction without a difference, it appears.
Sometimes when you have an opportunity to talk to Senator Black, those of you who are watching, you need to learn about his hobby of going down the Everglades and taking a stick and looking for snakes. But we'll go to the Everglades another day.
Well, we won't be vacationing together anytime soon, Dick. I
Well,
just understand that I don't like snakes.
So with that start, then Senator Stanley, why don't you start talking about some of the issues, and Senator Black join in?
Well, certainly, the issues that we see this year are not uncommon that we see every year, but certainly one of the biggest issues that we've had is whether to expand Medicaid or not and cover the coverage gap between those that are covered by Medicaid and those that are not covered by the Affordable Care Act. So that's been a great debate. Some Republicans on the Senate side offered an alternative called Marketplace Virginia. Certainly that was debated in our budget discussions when we voted on the budget, and that has been really something that I think we've been wrestling with. I personally believe that, quite frankly, expanding Medicaid under a promise from the federal government that we're going to receive billions of dollars from that federal government for a certain number of years, expand the rolls of Medicaid to up to 400,000 Virginians, and then in 3 or 4 years when the federal government rolls that back, how are we going to pay for it? And that's the real concern. And I think, quite frankly, it's a feel-good Band-Aid on a bigger issue. And I think we should be thinking globally in how we solve some of the issues that face healthcare rather than just trying to throw money at something that doesn't solve the problem.
Senator Black?
Yeah, you hear a lot of people say, well, we shouldn't expand Medicaid until we reform it. But we've been trying to reform Medicaid for decades and decades. I mean, I was a young man when we were trying to reform Medicaid. It's probably the most corrupt government program we have. I come from Miami, where that one city has 1/3 of all the nation's Medicaid fraud in a single city. It's just stunning. There's actually a market where on the open market you can buy lists of names to do fraudulent Medicaid claims. So it's a very poor program. Understandable that we've got to do it for certain of our lowest income people, but we're proposing to move it well into the middle class, and I think, I don't think that's where we need to go. I really believe in the marketplace. We started off with the finest medical care system in the world, and here we are with a Obamacare, which I think the great majority of people agree is a failure, and we're stuck with it, and we're trying to weave our way out of it. But I don't think we want to delve in more deeply in Virginia by doing an expansion that adds another anywhere from 250,000 to 400,000 people to the welfare rolls.
So beyond that big issue that's still being wrestled with, and maybe some project may even be wrestled with past the scheduled adjournment, we'll have to wait and see. But what are some of the other issues that you all have worked on that you think would be helpful? I know your constituents know the issues you've worked on, but let's help our statewide audience. What else have you been working on?
Well, David, I come from Southside Virginia, which is, of course, from Galax to Halifax, everything in between. I think the Democrats, when they redrew the lines, gave me a little bit of North Carolina, too.
Just a little.
Just a tiny bit. But what we're facing there is Southside used to be the economic driver in Virginia many, many years ago, textile manufacturing, tobacco. And what we've seen is, of course, with NAFTA and other things happening, that those jobs have gone away from Southside. So what has resulted is we've had higher unemployment and a higher poverty rate than the rest of the state. Martinsville City has the highest unemployment rate in the state consistently. So those are issues that I come to Richmond thinking about every year. Also, how to combat poverty, not by giving handouts, by giving a hand up, creating opportunities. So a lot of my legislation this year has been about making sure that those children have the same opportunities irrespective of their zip codes. So my focus has always been on job creation, job training, trying to get ready to bring the economy back in our area by making a workforce that is ready, willing, and able to be there. Right now we spend so much on public education, $140,000 from K through 12. That's our tax dollars to educate our children down there. But when they graduate, there's no jobs for them. So that investment that we make in them goes into another area or goes into another state. We've got to create a new economy for them so that they, when they graduate, will stay there, put down roots, raise a family, have a job, and be a vital part of our economy.
Senator Black, what are some issues that...
Well, you know, one interesting thing that I am working on right now is it's an issue I'm working with the National Organization of Women on.
Shocking.
Yes. And what it is something that's beginning to take hold across the country, where we have rape test kits that have been, you know, the tests have been performed on victims, and for various reasons they go untested. In some cases, there may just be a feeling that, you know, we don't have an ironclad case and so forth. But you know, I was a former prosecutor. I was chief of the criminal law division for the Army, and one of the things that I found is that often you can, in the area of rape and child abuse, you can take a weak case, and if you can find another similar case with a similar fact pattern, you can create a very strong case. And by doing these, the rape testing and testing these kits, often you can connect a series of dots, and you'll take these cases and you'll say, oh, now wait a minute, here's a similar claim, maybe by weak victims who you know are maybe not the most credible victims, but if you have several disconnected cases and yet the victims tell a consistent story, all of a sudden you take a serial rapist off the streets. They're doing this in Texas, they're doing it in Detroit, they're doing it in New York City. New York City has had really impressive results by doing it. So our first step is to find out what's out there in the localities and determine whether it's something that, you know, where we do need to do testing. But there seems to be pretty good support for it so far.
Stanley?
Well, as I said earlier, my bills have focused on job training. One of the most important bills I think we've carried through the Senate and are hoping for a positive result in the House revolve around what's called WorkShare. WorkShare has been used in 19 other states. It's a quasi-federal program. The federal government will help you set it up at the federal government's cost. But when we have layoffs, the problem is that when a big company lays off its workers like they do down in our area, you have a workforce that's on the sideline. And the reasons for the layoffs, usually because of these companies, is an economic downturn, or they're not producing or selling enough. And so what they're doing is they're shedding a workforce that, quite frankly, they should keep working. So work share allows you to reduce the number of hours to allow the participating businesses to keep their people working, keep their benefits, but at the same time, reduce those hours so that they can overcome the economic downturn or the reason that would otherwise cause their layoffs. That's a way that we can save jobs in Virginia. Nationwide, that program has saved 220,000 American jobs. So I think it's a very good program we should be doing here in the Commonwealth of Virginia. Other things I've been focusing on are financial literacy. One of the big common causes of poverty and the failure to escape poverty is that most people are financially illiterate. So we've been trying to create a piece of legislation where our community colleges get together with the Virginia Employment Commission, and those that are receiving benefits will be offered a financial literacy course free of charge to teach them how to save money, how to plan for the future, so that they're not becoming dependent on the state dole, but rather in a temporary situation that when they rise out of it, they'll be better equipped to manage their money and be successful in the future.
Sounds a very interesting one. Senator Black, any other issue you'd like to mention?
Yeah, one thing that I think has a lot of interest this year is mental health. And we had a tragedy involving one of our own Senate members. His son was very troubled, and they took him to receive treatment, and because they couldn't do it within the timelines prescribed by law, there was a real tragedy that resulted in his death and the injury of Senator Deeds. We, I think as a nation, you go back to the movie Clockwork Orange, and we had this idea that everybody should be out on the streets, and I think unfortunately there are some folks who really need to be treated in an institutional setting, and we are making progress. I think this year we've made some really serious progress towards relooking the entire mental health system and perhaps getting some people who are in a crisis or who are just simply a danger to the community, getting them institutionalized where they and the community are safer.
We'll remind our viewers that as the session is winding down, this is an issue where the Senate is addressed this way, the House slightly differently, and so it's a matter of the two chambers working together to try to work out the differences, and then and I'm sure they will, that you will, and something then will go to the governor.
I think we're going to see, this is an issue that's been supported on a bipartisan basis.
Yes.
And I don't think it's something that comes either from the House or the Senate. I think it's something everyone has a very genuine commitment to. So it's one of these rare instances where everybody's in agreement.
I'm really glad that you all have brought up that issue plus other issues in our closing minute. Is there another one, Senator Stanley, that you'd like to?
Well, I think I'd want all of your viewers to know that we work very hard to balance our budget. We're different, and yet the same as the federal government. The federal government was modeled after the state model, but we balance our budgets. We're part-time legislators, and then we go home. So we manage the people's money with great care and great confidence. I wish the federal government could do the same thing that we do down here. We may go into overtime because we're fighting over some very important differences within the two budgets, but I don't believe that we'll allow Virginia's government to shut down July 1st.
No, it hasn't happened, and I commend you and the two senators and all the legislators working on this, because I don't think any of us who watch it believe that it will go into a time when the state would not have a budget. So
no, we will make sure that we work hard and we'll roll up our sleeves. We may fight like brothers and sisters, but we'll get it done. We'll get it done for the people here in the Commonwealth.
So we'd invite the folks north of the Potomac just to keep an eye and see how it's done.
Absolutely. We'll give lessons to them anytime they'd like.
Yes.
That's right.
Senator Stanley, Senator Black, thank you
David.
both so much for being on This Week in Richmond. Look forward to having another conversation
Well,
with you.
thank you
in the
very
future.
much.
Thank you, David.
Thank
Take
you.
care.
I'd like to welcome Senator Emmett Hanger to This Week in Richmond. Emmett's been serving in the Senate since 1996, but prior to that, from 1983, 1992, served in the House of Delegates.
That's correct, right?
From the great Shenandoah Valley, Virginia. So talk about any issues that you'd like to help people better understand some of the issues that you all are wrestling with here at the end of the session.
Well, there's quite a number of them, and I've specifically been involved. Each year I seem to be involved in environmental issues, conservation issues, and this year is no exception, working on some issues relative to clean up the Chesapeake Bay. This year I've had a number of initiatives in the educational arena as well, and of course in the backdrop of all of it this year is my involvement with healthcare reform, and specifically how we're going to react with the decision we need to make in Virginia as far as whether or not we would extend affordable access to health care to lower income Virginians in a more comprehensive way. So got all three of those areas out there, and I'd be glad to speak to any one of them that you'd like to talk about.
Well, why don't you start with the last one, because while there is certainly differences of opinion, there also seems to be some, at times, misunderstanding of what's being proposed over in the Senate.
Okay. Well, just to step back a moment, I think everybody is being hearing, but in fact, millions and millions of dollars have been spent in efforts to inform us about Obamacare or the Affordable Care Act and potentially expanding Medicaid. But very little of it has been directed in a nonpartisan, objective way. Most of it is coming from one side or the other that's just trying to sell their message. So, if we assume that people are understanding, it is tough to understand. But the basic bottom line is Medicaid, not Medicare. Medicare is a program, of course, we're familiar with for individuals 65 and older. That works very well, actually. It's a paid-for program. Some people who are disabled can also fit in under Medicare. That's one program. It's a federally administered program. Medicaid, on the other hand, is a state-administered program. So whether or not the Affordable Care Act was going to be overturned was being heard in the Supreme Court, they ruled, and I think correctly so, that Medicaid is a state program, and states have the decision to make as far as the operation of that program, including who is eligible and the conditions under which they would be eligible and the payment rates and what have you. So that kind of upset the apple cart, if you will, because it had been anticipated under the provisions of the Affordable Care Act that all of the states would expand their Medicaid programs. Well, we're wrestling here in Virginia now with how best to deal with that. The problem, there are a number of problems and opportunities inherent in it, and I'm grappling for the opportunity. And that opportunity is that we have not been able to come to grips in this country and in Virginia with health care in general. The costs are rising tremendously. They're on a steep incline, and we're getting to the point where we have great health care if you can afford it. But more and more people are dropping out of affordability in terms of not being able to afford insurance, and more dollars are being required to maintain commercial insurance packages. So that's the big broad subject, healthcare reform. So I'm working on that. Within that, we have to decide, we have a decision to make as far as accessing federal dollars that we're currently being taxed or assessed as a part of the Affordable Care Act. A lot of Virginians it hasn't hit them directly yet, but the Affordable Care Act is being paid for with a series of new fees and taxes and some cuts that hit hospitals. And so those cuts that hit hospitals particularly are a source of immediate urgency. They had agreed as a part of the Affordable Care Act that reimbursements under Medicare would be reduced, that payments for indigent or individuals that show up at hospitals that don't have the ability to pay, that get treated, would be paid for in a different way than they currently were being paid for, either through federal funds and through state taxpayer dollars. So we have, the figure comes to over $2 billion annually. Some have suggested the figure is about $2.9 billion that we're currently paying to the federal treasury. And in order to receive some of that money back, it is intended that we set up some way for an expanded population of lower income Virginians to have either access to health insurance or access to health care in some manner. And so the plan that I've been working on, and there's been a lot of work done on this, I've been chairing a Medicaid Innovation Reform Commission where where the first thing people will say about Medicaid, oh, it's a broken system, a lot of fraud, waste, and abuse, it's not efficient. Well, we've been working on that, and we've made significant strides over the past year in implementing various reforms, which already are saving us literally hundreds of thousands of dollars in the state budget. But the decision at hand is expanding the population so we qualify for some of those federal dollars back. And we've come up with a private option, which it really is a composite of some of the actions that other states are taking. Arkansas, Iowa, Michigan, Wisconsin, quite a number of states are working on not just direct Medicaid expansion, but a plan where private insurers can be incentivized or impart the insurance premiums paid from this fund of federal dollars that we can access. I support it. I think it's a wise way to go. From an economic standpoint, I don't think we can afford not to do it. And from a humanitarian standpoint, certainly I think it has become what some have referred to as a moral imperative that we do it, because the current system that we have simply creates impediments for people of lower income to be able to get affordable access to health care, particularly in a timely manner. You can get it if you go to a hospital after you've had an illness for a while and you want treatment, you'll get treatment, but chances are you would have put it off because you were afraid it would bankrupt your family. You didn't have insurance or the money to pay for the fees, and so you put it off as long as you can, and you show up at the hospital in the emergency room, and in many instances, and we hear about it all the time, it's just too late. You're not going to have a good outcome, and there'll either be a death or a shortened lifespan associated with that lack of timely health care.
So that's the issue that will keep the two chambers working to try to particularly reconcile the difference between the House position and the Senate.
And there is a distinct difference between the House and Senate on that, and I'm hoping we can bridge the divide. And it's a deeply dividing political issue as well. There are a lot of groups that are invested in the outcomes and trying to influence the outcomes. Some of them are reasonable and working with facts. Others are just, unfortunately, there are a number of them that anything associated with the Obama administration they want to see defeated. They don't care whether it's good policy or not. And you'll find that there's a countervailing feeling on from some of the other more liberal advocacy groups. But the truth of the matter is we can't, and this is what I continue to reiterate whenever I have a chance, we can't afford to do nothing. Now, Virginia needs to take some leadership here because I'm a strong supporter of life, but you also have to look at quality of life. And when you have a system that increasingly is pricing people out of the market so they don't have access to health care without bankrupting their family, then you got to do something. And I think the time is long overdue for us to do something.
Well, thank you for laying that explanation out. Now, you mentioned too the environmental issues that you've worked on for many years on Agriculture, Conservation, Natural Resources Committee.
Right.
Any big issue?
Well, I've been involved with our strategies to clean up the waters of the state, and on that, of course, we're trying specifically to clean up the tributaries going into Chesapeake Bay, making good progress there. We've had great success, I think, with agricultural best management practices and taking steps to keep nitrogen and phosphorus and sediment out of the waters flowing into the bay. And we've also expended a lot of state and local dollars upgrading our waste treatment facilities. So we're seeing measurable success in terms of restoring the fisheries and when you test the waters. And so that's positive. The one area where we have not made as much progress is stormwater management. And so that's been a focus this year. I've carried legislation in the past, and this year I'm carrying legislation as well, which basically is putting in place some policy, and hopefully with appropriate funding, so that we can more aggressively clean up the more urban areas of the Commonwealth, where we are continuing to kind of flush our streets out and dump all of that spill into the waters and into the bay. So over the course of this session, we've had stakeholder groups working on the legislation that I'm carrying that's also in the House that I believe is going to be very beneficial in our long-term effort to clean up the bay and the state waters. So I'm real pleased about that progress.
Senator Hanger, thank you so much. Time is running out. We're going to have you back on sometime to talk about education and
I'd
other
love to
issues.
do that.
But we thank you for being on This Week in Richmond.
Okay, thank you, David. Appreciate it.
This Week in Richmond is made possible in part by Dignity Memorial, caring for our communities with a network of funeral homes and cemeteries in Virginia and throughout North America. More information about Dignity Memorial's providers is online at dignitymemorial.com. Alpha Natural Resources, an energy company dedicated to respecting the land. Alpha Natural Resources, we power the world through the energy of our people. Haley Buick GMC, the place for a new Verano or Terrain Denali, in Richmond and online at haleybuickgmc.com. Everywhere there are lighting poles, there's one more opportunity to save money. Intelligent Illuminations provides cost-effective wireless lighting solutions for roadway or area outdoor lights. Kanawha Valley Arena, Virginia's cowboy town, hosting an array of events from Civil War reenactments to diesel truck pulls. More information online at virginiarodeo.com. The Virginia Chamber of Commerce, the voice of the Virginia business community, working in legislative, regulatory, and political arenas to promote the free enterprise system. So what do you do? Information about getting involved in advanced technology careers, making everything from clean energy to life-saving medicine, is available at dreamitdoitvirginia.com. Additional support is provided by these sponsors. And by the members of Virginia's public television stations. Thank you.